As a co-founder of the EGFR Resistors Lung Cancer Patient Group, I am one of the authors of this abstract. In collaboration with Longevity Foundation, we undertook Project Priority to understand the lived experience of an EGFR-positive lung cancer diagnosis. As a patient group with close to 3,000 members from over 80 countries, the EGFR resistors are in a unique position to drive this study, since our organization can transcend the barriers that exist to gathering such real-world data across institutions and countries. We have been fortunate to present some of the findings of Project Priority at previous conferences. Real-world data, such as we have gathered, is critically important in order to understand many aspects of the lives of patients who often differ from the small number of participants studied in clinical trials in terms of performance status, comorbidities, brain metastases, and other characteristics. In this abstract, we have found that although osimertinib is currently considered the standard of care for first-line treatment of patients with EGFR-positive lung cancer and second-line treatment for those treated with other EGFR TKIs, osimertinib is not always prescribed this way in the real world. While we acknowledge that access issues in some countries make treatment with osimertinib currently not possible, our analysis of real-world treatment trajectories suggests that there are additionally many patients who are not receiving guideline-adherent care. Failure to receive guideline-adherent care may be due to a number of factors, including delayed initial biomarker testing, lack of repeat biopsies upon progression, and/or practice-related beliefs about TKI usage and sequencing. In a previous Project Priority presentation, we showed evidence that our patients in the real world tend to experience more side effects than seen in clinical trial data. However, we've also found that patients who take osimertinib categorize many of the side effects they do experience as mild, as opposed to the moderate or severe side effects experienced by patients on the earlier generation TKIs of erlotinib and afatinib. Following guideline-adherent care thus allows patients with EGFR-positive lung cancer to maximize quality of life in addition to receiving the best possible treatment. We feel that this is an important point to bring to public awareness and necessary to address through increased education in many areas.